Hi, this is Andy, Hell's Canyon Pharmacy. I just wanted to put together a quick video to go over the semaglutide prescription that you just picked up. When you pick up your prescription, it should look a little something like this. Inside your bag, you'll have a couple of things. We'll have the actual semaglutide comes in this light-proof bag, and then a bag with 4 syringes, 4 alcohol swabs, and then there should be a little instruction sheet that will actually have a QR code to link to this video just in case you have any questions. The instruction sheet also has all of the directions written out step by step for you. First thing you want to do, you want to keep your semaglutide in the fridge, and then each week, once a week when you do your injection, you want to get your product out. 1 syringe, 1 of these alcohol swabs. If you've never done any injections before, this is actually super painless, just a little poke and very simple to do yourself. You'll want to take your alcohol swab, open it up. You want to swab the top of the vial. Some people prefer to do it more than once, so 1 to 3 times. So while that is set aside drying, you'll want to pick a site on the body to actually inject your medication. I would recommend the abdomen. You can use the upper arm or the thigh. However, I think for self-injection, using someplace on your abdomen is probably the easiest. You want to pick a place where you can get a little bit of skin pulled up, and then you'll want to swab that area. So whether it's, some people will recommend you do quadrants. So, 1 week, then lower abdomen, 1 week, 1 week. I don't think it really matters, honestly, as long as you're not getting super sore. You want to keep a 2-inch radius around your belly button, so nowhere within 2 inches around your belly button. You want to grab that area that you're going to inject, swab that real well, and then you want to drop your medication. So after you've done a few injections, you may start to create a vacuum inside the vial, so it gets harder and harder to draw up your medication. So if you need to do that, you would want to inject the amount of air that you're going to be, the same volume that you're going to be withdrawing of medication. So let's say you're doing 25 units for your injection. You'd want to draw your syringe up to 25, and then we'll inject that into the vial. And then we will draw up 25 units. And you want to make sure you try to get as much of air bubbles out of there as you can. You don't want to have a bunch of air in your injection. And there's 25. And then at this point, that area that you've swabbed, you'll want to pinch that area up. You will push the needle in at a 90-degree angle, so basically perpendicular to your skin. Push that in, depress the plunger, and then you want to wait about 5 seconds while it's still in there, make sure the medication is completely delivered. And then you can remove it straight out. And then you'll want to find a good sharps container. You can buy these at a local store or pharmacy, so somewhere safe to put your needles. If you don't have something like that, you can use like an old laundry detergent, like a plastic thick-walled bin to put them in, and then make sure you check with your local guidelines for proper disposal. That's pretty much it for an injection. Side effects wise, it is completely normal to experience nausea either the day of or a couple days post-injection. Other side effects, diarrhea, stomach upset, those are completely normal with this medication. To reiterate, you do want to keep this vial inside of this bag, inside of your refrigerator at all times. This is a light sensitive medication, and you do want to keep it stored in the fridge to keep it as potent as possible. Once you puncture the vial, it is good for 28 days. That's the way we have it labeled. If you use it for longer than that, that is up to you, but technically they are supposed to be used, and once it's been punctured, 28 days after that first puncture is when it should be disposed. If you do have any questions regarding injections, how to use this medication, side effects, anything that wasn't covered in this video, please just give us a call. Hell's Canyon Pharmacy, 208-743-5515, and we'd be happy to help you. This is all explained again in the instruction sheet with your prescription. And again, this video is linked on the QR code on that instruction sheet.